Hey, welcome everyone, and thanks for joining Assissi Animal Health for some education today. What I ate really hurts. Pain and inflammation in pancreatitis is the topic, and our presenter is Kara M. Burns. Kara is a licensed veterinary technician with a master's degree in physiology and a master's degree in counseling psychology. Ms. Burns is the founder and past president of the Academy of Veterinary Nutrition Technicians and has attained her VTS nutrition. She teaches nutrition courses around the world on the VIN Veterinary Support Personnel Network. She is the Director of Veterinary Nursing for the North American Veterinary Community, NAVC, and the Editor-in-Chief of Today's Veterinary Nurse. She was named the North American Veterinary Conference Technician Speaker in 2013 and again in 2016. She was granted an honorary VTS in internal medicine in 2011 and an honorary VTS in dentistry in 2012. We welcome Kara Burns.
Thank you so much. And thank you everyone for attending today. We're going to be talking a little bit about pancreatitis, something that you're probably a little familiar with, and we're going to delve in a little bit deeper over the next 30 minutes. So first, a huge thank you to Assissi Animal Health for providing and sponsoring these webbies. What a great way to keep education alive, if you will, during the times of COVID, getting information out there to all of my colleagues working in shelter medicine. And so thank you to Assissi Animal Health. So as we mentioned, we're going to be talking about the pancreas today. And many of you probably are aware that the pancreas is responsible for producing hormones and enzymes which aid in digesting food. Also, probably a little bit more well known is that the pancreas is responsible for producing insulin to regulate blood sugar levels. So then how do we get from pancreas to pancreatitis? Well, itis always means inflammation. So with pancreatitis, then we're talking about inflammation of the pancreas. And the upper right image is showing definitely inflammation. It's showing how inflamed and angry that pancreas is. It's more common, I think, than many pet owners think. And it's not always diagnosed. Oftentimes we'll, hear later from a client that, or pet owner that says, oh, it was really kind of down and, just depressed for a couple of days, had some vomiting. Well, that certainly could have been an episode of pancreatitis. But typically with pancreatitis, it's extremely painful to the dog and it can be life-threatening. So when we hear about pancreatitis, or if we are seeing any signs that could be indicative of pancreatitis, we want to make sure that we get them to a veterinary hospital as soon as possible. Because again, unfortunately, I've seen too many pets lose their life especially from an acute episode of pancreatitis. So acute pancreatitis, as I just mentioned, is just what acute says. It's sudden. And typically, if we talk to pet owners, and many of you may have had dogs relinquished to shelters because of pancreatitis. And so what typically happens is the pet is fed or gets into some fatty food, especially around, we see it more around holidays, summer cookouts and barbecues. where especially the dog is getting into, you know, the hot dogs or hamburgers or French fries, et cetera, anything that is typically a fatty human food. And we also see it in those dogs that you probably are familiar with this term, garbage gut dogs. Those dogs that get into the rubbish and kind of sift through looking for all the good stuff, which is usually not good stuff for them. And so, so those two things typically lead to an acute bout of pancreatitis. Now, there is also chronic pancreatitis, and, you know, as with most things, it's occurs slowly over time, but it's typically from several acute cases of pancreatitis. So we have dogs and cats that have acute cases. We see them time and time again, and these pancreatitis cases then develop into a chronic pancreatitis. So what are some of the risk factors for pancreatitis? Well, let's look first at cats. Cats of any age, breed, or gender can develop pancreatitis. Older cats appear to be more likely to develop chronic disease. And just as I was just describing chronic pancreatitis, we see that in cats probably more so. And owners may not even know that their cat has had multiple bouts of pancreatitis. Oftentimes, those multiple bouts can lead to maldigestion, malabsorption issues, and can lead into exocrine pancreatic insufficiency as well. Also, I did say cats of any breed, which is still the case, but it is seen more prevalent in domestic short-haired cats, which you know are the regular-looking short-haired cats, non-purebred. And if we're looking at purebred cats and their prevalence, it's seen more in Siamese cats or those cats with Siamese heritage, so like a snowshoe. So what about risk factors for dogs? Well, breeds, again, stand out. So on the left-hand side, we have poodle, miniature poodle, standard poodle, toy poodles, and Cocker Spaniels are in the top left. And then if there is a poster child, if you will, for, or poster person, poster dog for pancreatitis, I think you as well as I know that that would be the Schnauzer, be it the regular size Schnauzer or I should say the smaller Schnauzer or the standard Schnauzer. So what other? Well, older dogs are definitely at a higher risk, and obese dogs, absolutely obese dogs. Because again, fat plays a huge role, not just in managing the dietary fat, but fat in and around the pancreas will lead to an inflamed pancreas. So obesity, cats and dogs, is a huge risk factor. And then we mentioned food. On the right, you see what I'm talking about in regards to a garbage gut dog, getting into the garbage, you know, sifting through. I'm sure that basset hounds can get into the garbage, but when I ask the question, you know, what breed is seen the most, you know, it's Labrador retrievers or mixed breeds with Labrador in them. Probably followed second by German Shepherds and mixed breeds with German Shepherd in them. When I first started in veterinary medicine, it was definitely German Shepherds were the top garbage gut dog, and it seems now to have switched with Labrador Retrievers. And then on the left-hand side, you see fish and chips or chicken strips and French fries. Again, high fatty foods that, you know, dogs typically don't eat. We see an influx of pancreatitis cases again through the summer with barbecues and cookouts, but also around the holidays. Thanksgiving is huge because owners are kind of handing some stuff to their dogs because it's a family gathering, right? And also dogs are seeing, you know, that turkey or whatever it is, ham, that is being cooked, and they want a piece of it. And, you know, like some dogs, they will just help themselves. So we know that fatty foods and getting into the rubbish are two huge risk factors. So what are some of the signs? What are some of the symptoms? Well, vomiting is well documented. Diarrhea, severe lethargy, dehydration, and that dehydration is obviously going to be from the first two. Abdominal pain, and you'll see this French bulldog on the bottom. It's kind of doing the downward dog yoga position that we hear about. This is actually a painful position. They're exhibiting that they're in pain, not just French bulldogs, dogs in general, because they're trying to find a comfortable position because they're in so much pain. And so usually the front half of them is down and the back half is elevated. And then also fever, shock, and oftentimes we'll also see jaundice or icterus, and we know that to be the yellowing in the skin and the sclera. So what are some of the diagnostics? Well, history and a nutritional history is huge. We need to find out what has gone into that patient or what they have eaten, whether it's, you know, their normal food, or is it something that they got into. And this is truly, we need to get in depth with this because of the questions that we ask will prompt owners' recall. You know, if we say, you know, simply, hey, what do you feed? Well, they'll probably tell us, you know, the brand of dog food if they're feeding a canned or a kibble food. But if we ask the question, you know, okay, additionally, what could they have gotten into? Tell me about, you know, the day yesterday or your weekend. And that's when we start to find, you know, maybe there was a family gathering, maybe there, you know, were hot dogs or whatever within reach. And additionally, a physical exam will be performed with body condition, and we're going to be palpating the abdomen because, as I've mentioned a few times, this is an extremely painful condition. And then some sort of diagnostic imaging. You see the dog on the right having an ultrasound of their abdomen. That dog is actually being very good. If it was truly extremely painful, we may have to give a little bit of sedation. So radiographs are also going to help. So again, some type of diagnostic imaging. In the background here, you do see the ultrasound machine. But with radiographs, we're trying to rule out foreign bodies, maybe fluid and edema within the abdominal cavity. Is there displacement of organs? And then the ultrasound again will confirm that inflamed pancreas. And so let me give you a visual here. And I am not an ultrasonographer, so I like it when it comes with arrows, and I tried to put some verbiage on there so we're all seeing the same thing together. So the white arrows are pointing to an enlarged pancreas. I think you can see that. And the black arrows, it's kind of a brighter coloring, if you will. That's pointing to fat, and that fat is hanging out around the enlarged pancreas. So again, that nutritional history is extremely important because we want to know, what are they being fed? And we have to ask these questions without judgment, because everyone does this. You know, I don't do this very often and I know better, but every once in a while, even my dogs will get, you know, something that maybe they shouldn't. It's not a lot, but owners are trying to love their pets, right? And consider them members of the family. So maybe they are getting an ice cream and sharing it with their pug, or sharing their pasta. And in the bottom right-hand corner, that Boston Terrier, he's checking out those 4 donuts. So we have to ask, and again, let's just ask in a non-judgmental, open-ended question type of format. You know, tell me what, you know, what your dog eats in a 24-hour period, or tell me, you know, what special event happened this past weekend, words to the effect. So when we're managing pancreatitis, obviously we're going to have to correct fluid deficits and electrolyte therapy, because with all the vomiting and diarrhea, there will be electrolyte abnormalities. Nutrition, obviously. And in 2020, there are some wonderful anti-nausea, anti-vomiting medications, which really work pretty quickly and very well. And the reason that I like those so much is because with those antiemetics, we can start to get nutrition into these patients sooner. And studies show that the sooner we can get nutrition into them, the better for the patient overall. And then, since I've talked quite a bit about pain, we absolutely have to focus on pain management. And we're going to look at a couple of techniques or a couple of modalities to help manage the pancreatitis patient's pain. But first, we're going to talk about one of my particular favorites, nutrition. So pancreatitis is considered part of the GI tract, and in this inflammation, and GI conditions absolutely respond to nutritional management and nutritional intervention. Early nutritional intervention is crucial, and that's why I love the new antiemetics that are out there, because they, you know, they knock down the vomiting and nausea pretty quickly, so we can get nutrition into these patients sooner. And then we're going to just look at a couple of key nutrients. There's more, but for today we're just going to look at a few. So I've been focusing on getting nutrition into these guys. And why is that so important? Well, if we can get nutrition into them as soon as possible, then they're not going to use their own muscle mass for energy. So we're going to decrease catabolism. We're also going to improve the immune response. And through nutrition, we can get that gut function returning to normal much sooner. So it is well tolerated, and here you see an NG tube going in, so we can either you know, feed them orally, or we can put in a tube and make sure we get nutrition in that way. So well tolerated. What we're looking for is food that is manufactured to be highly digestible and easily absorbed. because then the GI tract doesn't have to put any energy into breaking down the food and absorbing the food. If it's already digested, highly digestible, and easily absorbed, then that energy in our pancreatitis patients can go to healing. And essential nutrients, which we'll talk about. And the other thing with nutrition is most of the nutritional profiles are going to be a high energy, which means they get more energy, so they don't have to eat as often. So we're providing nutrients to the GI tract, then letting the GI tract heal, and not having to give as much food as often. I hope that makes sense. Let me know if it doesn't. So the first thing that I wanted to talk to you about is, again, water and electrolytes, because as I've mentioned a couple of times now, these guys are extremely dehydrated. And with this chronic or this acute vomiting and diarrhea, we're going to see their electrolyte status all messed up. And some might be high, some might be low. So we really have to be cognizant about their electrolyte status. And then once we're done with intravenous, as you see with this little guy, we want to make sure that our nutritional therapy that we are feeding, recommending when they return home, has higher levels of potassium, chloride, and sodium. With protein is actually a stimulus for pancreatic secretion. So we don't want to have excess protein. But on the other hand, we need enough protein to help the body recover and the tissues to be repaired. Fat. Think about the last time you've had a high fat meal. And I don't know, maybe you don't do fast food, but maybe at some point in your life, you had a big meal at Thanksgiving or a big holiday meal. Maybe you did do some fast food and you ate it, seemed really good going down, but a couple hours later, you're just like, oh man, I am just still just so full. It's because higher fat foods empty much more slowly from the stomach. So it's just kind of sitting there. And fat is going to delay gastric emptying. So what we're looking for, especially in our dogs, is low fat, lower than the amount fed prior. So this goes back to that nutritional history that I was talking about. We want to make sure we know the food that the pet was eating prior to this pancreatitis episode. Now, with cats, recent findings suggest that cats can digest and use high levels of dietary fat. So as of this point in time, cats are not considered to have to restrict fat in cats with pancreatitis. I'm still going to have a lower fat amount, especially lower than what they were eating prior, but it doesn't have to be as restricted as with canines. Antioxidants. We know that antioxidants are going to, or the lower the oxidative stress, the more inflamed tissues. And so we want antioxidants to help defend against that. And free radicals are going to impair cell function, decrease cell function, and lead to eventual cell death. So we want antioxidants to combat those free radicals so the cell itself can produce more energy. Prebiotics. Prebiotics, here you see flaxseed and beet pulp. There are others, but prebiotics are going to increase that beneficial bacteria, which is also going to help normalize the GI tract. Ginger, I don't know if anyone here is old enough, because I consider it more of an old wives' tale, but it actually is true, so I guess it's not. But when I was young, and if I had, upset stomach or upset GI tract, what were you given? Ginger ale. It's the ginger in there that helps to soothe and calm, if you will, the GI tract. So that's why I guess it wasn't an old wives' tale. I guess it was a true one. Omega-3 fatty acids. Now, these, if anyone's ever heard me talk before, omega-3 fatty acids are amazing nutrients. They help to break that cycle of inflammation. And we've been talking about pain and inflammation. It's almost a vicious cycle. And they help to stabilize cell membranes. So if we can make sure that there are omega-3 fatty acids in the nutritional plan when we're dealing with pancreatitis, it is going to help with that inflammation. The antiemetics, the anti-nausea and vomiting that I've been talking about, the veterinarian will begin those immediately. On the right, you see this dog is drooling, salivating, which is telling us that she is still extremely nauseous. So we're going to, the veterinarian is going to begin antiemetics. And we've been talking about pain as well. And there's that pose again, with this English bulldog's head on the ground and his butt's up in the air, because it's an extremely painful abdomen. He's trying to get comfortable. So pain medications will be, hopefully they should be prescribed by the veterinarian, because what we're looking for is some analgesia. We're looking for alleviation of that pain. And so it could be intermittent dosing or a continuous rate infusion. But while they're in the hospital with this acute bout of pancreatitis, they will be getting some type of pain relief. And then the Assissi Loop, which you see in the upper right, and I'm sorry, that picture is a little blurry, so I apologize for that. But the Assissi Loop also helps manage pain and inflammation in our pancreatitis patients. And so I'm sure many of you know that the Assissi Loop is pulsed electromagnetic field therapy. And what's happening here, and if you look at this model dachshund here, it's delivering a signal tuned specifically to minimize pain, inflammation, and accelerate healing. So what an amazing tool for our pancreatitis patients. And what this loop is doing is stimulating this pet's own natural anti-inflammatory process while speeding the healing of soft tissues. It's pretty amazing stuff. So we know that pancreatitis is extremely painful. And I don't think we've focused enough historically on the pain that accompanies pancreatitis patients. We also know and are going to remember that getting nutrition into these guys as soon as possible with the help of antiemetics is going to result in early recovery. We're getting nutrients into them, helping that body to heal with nutrition. And if we can get nutrition into them early, we get them feeling better earlier, then they'll be able to go home earlier. we also need to remember that with pancreatitis, we need nutrition and pain relief. And those two, especially working together, are going to help decrease the inflammation. And with a nutritional profile and using the Assissi Loop, we'll be able to manage that pain, manage that inflammation, get them on the road to recovery much sooner, and also then manage their potential for another episode, not just through, but through nutrition. So you have some tools, and it's, to me, it's pretty amazing that with nutrition and with a modality such as the Assissi Loop, we can help these painful patients.